Hello everybody, thanks for joining me. Today I'm going to be discussing lifetime hair donor availability. A lot of people come to me and they ask, how much hair do I have in the back of my head for surgery now and then also into the future? It's a good question, and so I'd like to discuss a little bit about how we as physicians determine a number and how you as a patient should interpret that number. Now, as you all know, the donor area is the back and the sides of the head, and that's the area that we use primarily for donor harvesting and using to implant in the front. Now, we can talk about beard and chest and body. I've done that in another video, but we won't be discussing that. Right now, it's just primarily about the scalp donor region. Now, when you come on in to visit a physician, hair transplant surgeon, they may examine the back of the area of the head. It's very important that they get a really good sense of the density, the type of hairs, and the groupings that you have back here. Oftentimes they may have to shave the head down in order to get those numbers, the density of hair per square centimeter. Sometimes they can do it with the hair long. But in general, the idea is to get a number of hairs that you can use in your lifetime. And that's important to know because you want to know for planning, which I can talk about in another video about planning more procedures over your lifetime. In general, patients, I always tell them as a ballpark figure, patients have between 5,000 and 7,000 or 8,000 total grafts that they can use in their lifetime. And it all depends on a number of factors. One is, of course, the size of the head. You know, the larger the head, typically the more number of grafts. Also the density. So if you have a lot of hairs close together in the donor area, that's going to bring up the density for your hair. Another factor which is important is that as a patient, you maintain as much of the hair as you can. So over time, it's important to use medications and treatments to prevent hair loss, because as you can imagine, if the area in the back gets worse and this area of loss increases, your donor area in the back is going to shrink. So then, in effect, you're going to be losing donor hair in the future. So it's a good idea to maintain as much hair as you have as possible, and that'll help to increase and maintain actually your donor availability for your lifetime. Now, the process of determining the number of grafts really comes down to, as I mentioned, to determining the density of hair per square centimeter, also the whole entire area of donor that's available. Now, there's some really quick formulas that physicians use. You know, typically we like to say less than 50% of the donor we can remove before we start seeing thinness. There's more scientific ways of going about it, which we like to try to do here at our office at Shapiro Medical. We've been working more into using the coverage value, or the CV, which you may read or hear more about. By using this coverage value, we're able to determine the lowest amount of hair that you could keep in the back and still maintain a nice cosmetic effect. And so our goal when you come to visit us, or when you visit any surgeon, is that you should get from them the total number of grafts that you might be able to have in your lifetime. It's important to have that number, that concept in your mind before even doing your first surgery. Because why undertake a surgery if you may not be able to complete your goals? And over time, you may need more than one surgery, unfortunately. A lot of patients want to just do one and done, but especially the younger the patient, the chances are higher that you may need more. And so it's important for you to have that total donor capacity known before you get started. Hope this helps. Thank you.